everyone, I'm Dr. Grace Holloway and welcome back to the channel. If you're new here, welcome. I've been practicing urology for over 20 years, and in that time I've sat across from thousands of men in my office who were too embarrassed to bring up what was really bothering them. And one of the topics that comes up more than almost anything else, more than people expect, is this: size. Specifically, what's normal? How do you actually measure correctly? And what happens when you think something's off? So today, that's exactly what we're going to talk about. And I want you to know before we go any further, if you've ever had this thought, if you've ever wondered, if you've ever Googled it at 2 a.m, you are not alone, not even close. I've had men in their 50s, 60s, even 70s sitting in my exam room, and they'll talk around the subject for 15 minutes before finally getting to the real question. And every single time, I have to stop them and say, I hear this every week. This is one of the most common concerns I deal with. You don't need to be embarrassed in here. That's what I want this channel to feel like, my exam room. No judgment, no embarrassment, just honest medical information from someone who spent 2 decades dealing with exactly these questions. Here's the first thing I want you to hear, and I want you to really let this sink in. Roughly 95% of men who are worried about their size, 95% actually fall within the completely normal range. That's not me trying to make you feel better. That's data, real clinical data from large-scale research. The anxiety is common. The actual physical problem? Usually not there. What's usually happening instead is a distorted perception. Men comparing themselves to unrealistic standards, especially from adult entertainment, where camera angles, editing, and selection bias create images that have nothing to do with what's actually typical in the real world. And here's something else worth knowing, especially if you've been carrying this worry for a while. Studies consistently show that more than 50% of men express dissatisfaction or concern about their size. Meanwhile, only about 5 to 10% of women, their actual partners, consider size to be a particularly important factor. That's a massive disconnect. Men are suffering over something that in most cases, their partners don't even rank as a priority. Now, after 20 years of practice, I understand why this happens. We live in a culture that sends men some pretty damaging messages about their bodies. The pressure is real, but the foundation those messages are built on, it's mostly fiction. So let's get into the actual science. Let's talk about what normal really looks like, how to measure correctly, because most men are doing it wrong. And then we'll get into what the options are if you genuinely feel like something needs to be addressed. And I'll also talk about something I see increasingly in older patients: penile curvature, which is a separate but related issue that deserves its own honest conversation. Let's start with measurement, because this is foundational. If you don't know how to measure correctly, everything else is noise. There are 2 dimensions that matter clinically: length and girth. I'll walk you through both. For length, you can measure either erect or in a stretched, flaccid state. In clinical research, both methods are used, but the stretched flaccid measurement is actually considered more reliable and consistent because it correlates very closely with erect length and is easier to standardize across different patients and conditions. Here's how to do it correctly. Use a ruler or a firm measuring tape, not a cloth tape that bends. Place it right at the base, pressing back against the pubic bone. Don't measure from the skin surface. Press in to reach the bone, especially if there's any extra fat tissue in that area. That's not cheating. That's just accurate measurement. Then gently but firmly stretch the penis outward toward the tip and measure to the end of the glans. That's your stretched flaccid length. If you're measuring erect, same principle. Start from the pubic bone, press back, and measure along the top to the tip. Don't measure from underneath, don't measure from the side. Top surface only, bone to tip. Any other method adds artificial length and gives you inaccurate data. For girth, you need a flexible measuring tape or a piece of string you can then measure. Wrap it around the mid-shaft. Not right at the base, not right at the tip, somewhere in the middle. Record that measurement. Most studies use erect girth as the standard, so if you want a number that compares to clinical data, measure when erect. Now here's why this matters so much. A huge portion of the anxiety men carry comes from inaccurate self-measurement. Either they're measuring wrong and getting a number that's lower than reality, or they're comparing their own flaccid measurement to someone else's erect measurement, which is completely apples to oranges. Inaccurate measurement creates unrealistic expectations, and unrealistic expectations create unnecessary suffering. So now that we know how to measure, What do the numbers actually say? There was a large-scale meta-analysis. That's a study that combines data from multiple research studies that looked at measurements from nearly 15,000 men across different countries and populations. This is one of the most comprehensive data sets we have. Here's what it found. When measuring stretched flaccid or erect length, between 90 and 95% of men fall in a range of roughly 4.7 to 6.3 inches. That's about 12 to 16 centimeters. The global average sits right around 5.1 to 5.2 inches erect, which is just over 13 centimeters. Let that land for a second. If you're anywhere in that range, you are with the overwhelming majority of men on Earth. For girth, in a flaccid stretched state, the average circumference is around 3.5 inches, about 9 centimeters. Erect, the average girth lands around 4.5 inches, roughly 11 to 12 centimeters. Now, medical terminology does define the extremes. A micropenis is clinically defined as an erect or stretched flaccid length below about 2.75 inches, under 7 centimeters. That is a genuine medical condition, and it's quite rare. On the other end, a macropenis, defined as above roughly 9.5 inches or 24 centimeters, is also very rare and can actually come with its own set of functional issues. The point is, the vast middle ground is enormous, and most men who are worried, they're solidly in that middle ground. Now, I want to address something that comes up a lot in my practice, and I know it comes up for many of you who are watching, and that's penile curvature. I want to spend real time on this because it's not discussed enough, and the anxiety around it can be just as significant as anxiety about size. Some degree of curvature is completely normal. Many men have a slight bend, left, right, upward. That's just how they're built, and it causes zero functional problems. We're not talking about that. What I want to address is what's called Peyronie's disease. This is a condition where fibrous scar tissue develops inside the penis, causing curved, painful erections. It's more common than most people realize, and it disproportionately affects older men. Studies suggest somewhere between 3 and 9% of adult men have it, though the real number may be higher because many men never seek treatment out of embarrassment. Here's what it typically looks like. You may notice a hard lump or plaque under the skin of the penis. Erections may be painful. The penis may curve noticeably, sometimes enough to make intercourse difficult or painful. Some men also notice a narrowing or hourglass shape during erection. The curvature can go in any direction, upward, downward, to the left, to the right. And yes, it can curve to the right. That's not inherently abnormal. The question is whether it's causing pain or dysfunction. Now, the good news, and I say this to my patients all the time, Peyronie's disease is treatable. You don't have to just live with it. There are non-surgical options, including oral medications, injections directly into the plaque, specifically a drug called collagenase Clostridium histolyticum, which has FDA approval for this exact condition, as well as traction therapy devices. For more severe cases, surgery is an option and can be very effective. What I do not want any of you to do is sit with this for years because you're too embarrassed to bring it up. If you're noticing curvature that's getting worse, or that's painful, or that's affecting your ability to have sex, please talk to a urologist. That is exactly what we're here for. I've been treating this condition for over 2 decades, and there's no reason to suffer in silence. Now let's talk about the elephant in the room, enlargement, because I know a lot of you are thinking about it, and I'd rather give you honest information than have you make decisions based on what you read on some website trying to sell you something. Let me be direct with you. There is a lot of garbage out there. Pills, pumps, stretching devices, herbal supplements, the overwhelming majority of these have no meaningful clinical evidence behind them. Some are outright dangerous. I'm not going to pretend otherwise just to be polite. What does have some legitimate discussion in the medical literature? Let me walk you through it honestly. For girth enhancement, one of the more commonly discussed procedures right now involves hyaluronic acid injections. Hyaluronic acid is a substance that naturally occurs in your body. It's the same thing used in facial fillers at dermatology offices. When injected into the penis by a qualified professional using approved products, it can temporarily increase girth by roughly an inch or so, somewhere around 2 to 3 centimeters. The effects are not permanent. The body gradually absorbs the material over 12 to 18 months, and then it's gone. Here's my honest take. This is relatively safe when done correctly. The key phrase is done correctly. That means by a board-certified physician, using FDA-cleared products in a proper clinical setting, not at a med spa, not by someone who got a certificate off the internet, not with products sourced from who knows where. And here's the part that concerns me most as a urologist. Some providers are using non-absorbable fillers, materials like PMMA, which stands for polymethyl methacrylate, or even industrial silicone, and injecting them into the penis. These are permanent, which sounds appealing until you understand the consequences. These materials can migrate, cause chronic inflammation, create hard nodules, lead to disfigurement, and result in injuries that are genuinely irreversible. I have seen the aftermath of these procedures in my practice, and it is not pretty. Please, please do not let anyone inject permanent filler into your penis. That is not a risk worth taking. For length, the options are even more limited. The two most common procedures you'll hear about are liposuction of the pubic fat pad and release of the suspensory ligament. Pubic liposuction removes fat from the area right at the base of the penis. This doesn't actually make the penis longer. It just reveals more of the shaft that was previously obscured by fat tissue. For men who carry significant weight in that area, it can improve appearance meaningfully. But I want to be clear, it's not lengthening the organ itself. The suspensory ligament release involves cutting the ligament that anchors the penis to the pubic bone. When that ligament is cut, the penis can hang forward more, which can make it appear slightly longer in a flaccid state, maybe an inch or so. But, and this is critical, it does not increase erect length, and cutting that ligament can cause instability during sex and increase the risk of injury. Scar tissue formation post-surgery is also a real concern. The World Health Organization and multiple major urological associations do not recommend this as a first-line treatment. In most cases, the risks significantly outweigh the cosmetic benefit. Let me also address penile implants briefly because I see a lot of confusion about this online. Penile implants are not a cosmetic enlargement tool. They are a medical device used to treat severe erectile dysfunction when all other treatments have failed. They're prosthetics, not enhancements. They're used when a man literally cannot achieve an erection by any other means. If someone is marketing implants to you as a way to increase size, they are misleading you. Full stop. So if you're considering doing something about this, here's my honest advice after 20 years of practice. The most important tool you have is accurate medical information from a real physician who isn't trying to sell you a procedure. Before you do anything, ask yourself, why do I want this? Is this genuinely about function and quality of life? Or is it about an external standard I've been told to measure up to? And if it's the latter, if it's about comparison, about what you saw somewhere online, about something a partner said years ago that stuck with you, I would genuinely encourage you to talk to a therapist who specializes in men's health or body image. Not because something is wrong with you, but because that kind of work can give you real lasting relief that no procedure can replicate. I want to take a moment to talk specifically to the older men watching this, because your experience is a little different and you deserve acknowledgement of that. As men age, there are physiological changes that affect the genitalia. Some men notice what feels like a slight decrease in size. This can happen due to reduced testosterone, reduced elasticity in the tissue, or simply changes in body composition, including increased pubic fat. These are real changes, and they're normal parts of aging. They don't mean something is wrong with you. What I see in older patients is that these changes, combined with perhaps a lifetime of insecurity or comparison, can feel particularly difficult. You're dealing with changes in erectile function, changes in libido, changes in body image, all at the same time. That's a lot. And I want you to know it's okay to bring all of that to your doctor's office. A good urologist will not dismiss any of it. For older men specifically, I also want to mention that Peyronie's disease is more prevalent in this age group. If you've noticed increasing curvature over the past year or two, don't chalk it up to just getting old. Get it evaluated. It's treatable, especially when caught earlier in the process. Now, I want to close with something that might surprise you. A little bit of history that honestly changed the way I think about all of this. If you look back at ancient Greece, and I'm talking about classical antiquity, the height of Greek culture and philosophy, the male body ideal was very different from what we assume today. When you look at ancient Greek sculpture, at statues depicting the wisest men, the strongest warriors, the most heroic figures, they are consistently depicted with smaller genitalia, not by accident. That was the ideal. In ancient Greek culture, a large phallus was associated with foolishness, lust, and lack of self-control. It was literally a symbol of being led around by your desires. The restrained, controlled man, the philosopher, the general, the respected citizen, was depicted with modest proportions because that signified mastery over himself, intelligence, virtue. Now, I'm not saying you should restructure your entire self-image around ancient Greek aesthetics, but I do think it's worth pausing on this. The standard you've been told to aspire to, the one causing anxiety and distress, is not some universal timeless truth. It's a cultural construct. And like all cultural constructs, it changes. What is considered desirable today is not what was considered desirable 2,000 years ago, and it won't be the same 2,000 years from now. So why would you let something that arbitrary define your sense of self-worth? The truth is that the vast majority of concerns about penile size are not rooted in medical reality. They're rooted in social pressure, in media, in comparison, in misinformation. The physical problem, in most cases, simply isn't there. What is there, and what deserves real attention and real compassion, is the psychological weight that so many men carry around this. That weight is real. I've watched it affect relationships, affect intimacy, affect how men carry themselves in the world. And it doesn't have to. Not when the foundation it's built on is this shaky. What matters, and I mean this as a physician and as someone who has sat with thousands of patients over 2 decades, is your relationship with your own body, your overall health, the way you communicate with your partner, the respect you bring to yourself and to others. Size does not determine your worth. It does not determine your attractiveness. It does not determine your ability to be a good partner, a good man, a good human being. If this video helped clarify anything for you, if the numbers gave you some relief, or if the information about curvature or about procedures gave you something useful to think about, please subscribe to the channel. That's what I'm here for. Breaking down the myths, giving you real science, and doing it with straight talk and genuine respect for what you're going through. I'm Dr. Grace Holloway, and I'll see you in the next one. Take care of yourselves.